Let us pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and the county assemblies for the welfare of society and the just government of the people, we beseech you to behold with abundant favor as your servants whom you have been pleased to call to the performance of important trust in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our country and of those whose interests you have committed to our church. Amen. Honorable members, I'll refer to our standing order. I'll request the Sergeant at Arms to ring Quorum bell for the first 5 minutes. Honorable members, while the bell is being rung, you are not allowed to move. Only the whip, but I'm not able to spot whip, even the deputy. So, Honorable Ouko, kindly whip members to come in. Honorable members, the whip is not back. Therefore, I'll request majority. I'm able to spot Honorable Jagongo on majority seat to confirm if we have quorum.
Thank you, Madam Speaker. Madam Speaker, we have quorum.
Madam Clerk, kindly take us through the order of the day.
Order paper number 341 of today, Wednesday, 3rd September 2025 at 2:30 p.m. Order number 1, administration of oath.
Next order.
Order number 2, communication from the chair.
Next order.
Order number 3, messages.
Next order.
Order number 4, petitions.
Next order.
Order number 5, papers.
Next order.
Order number 6, notices of motion.
Next order.
Order number 7, statements.
Honorable members, it is statement hour. Yes, Honorable Samuel Nyango.
Thank you, Madam Speaker. Madam Speaker, pursuant to standing order number 41-2B, I rise to seek a statement from the chairpersons of the Committee of Education, Technical Training, Innovation, and Social Services, and Sports, Culture, Gender, Youth Affairs about the agreement on the management of Kanyakwar Cultural Center in Railways Ward. Madam Speaker, aware that the county government of Kisumu undertook the renovation of the Kanyakwar Cultural Center located in Railways Ward during the financial year 2024-2025, and that the facility is now fully refurbished and ready for public use. Further aware that it is in the public domain that the county government of Kisumu has entered into the agreement with Utalii College regarding the management and operational oversight of the said facility. Madam Speaker, in light of the above and the recognition of the importance of transparency, community involvement, and potential socio-economic impact of this partnership, I hereby seek a response from the committees on the following matters. 1. What are the specific terms and conditions of the agreement signed between the county government of Kisumu and the Utalii College, and what tangible benefits are expected to occur to the local community as a result of this partnership? 2. Was there any public participation conducted prior to the signing of this agreement in accordance with the principles of public accountability and constitutional requirement for citizen involvement in matters affecting them? So, Madam Speaker, it is my hope that the two committees will provide a detailed response to ensure that the residents of Railways Ward and Kisumu County at large are well informed and adequately represented in decisions that impact their cultural heritage and economic well-being. Thank you, Madam Speaker.
Honorable members, this is a statement directed to Committee on Education and Sports, and I'm not able to support Education Chair Committee in the House or the Deputy. Even sports, even the Deputy. Okay, Honorable Were, do you have something to say right now? You are not the Deputy. Okay. I want to give you 1 second to say something. If you have direct answer right now, or I give you some time as a committee.
Thank you, Madam Speaker. Madam Speaker, I would request that you give us 2 weeks. Then we shall furnish this house with the responses that are required. Thank you.
Thank you, Honorable Were. As requested, I'll give you 14 calendar days to do investigation and then bring the report back to the whole house. Next. It is still statement hour. Yes, Honorable Moses Ochele.
Thank you, Madam Speaker. Madam Speaker, pursuant to the provisions of Standing Order number 41-2B, I rise to request a statement from the chairpersons of the Committee on Finance and the Committee on Agriculture regarding the matter of privatization of Miwani, Chemelil, and Muhoroni Sugar Companies. Section 114 of the County Governments Act 2012 provides that the development of national significant projects within a county shall be preceded by a mandatory public hearings in each of the affected counties, and that such projects shall, subsequent to those hearings, be considered and approved or rejected by respective county assemblies. Honorable Speaker, the 3 sugar companies situated in Kisumu County are not only nationally significant projects, but also critical to the socio-economic well-being of the residents of Miwani, Chemelil, and Moroni, and Greater Sugar Belt region. Their privatization has therefore generated considerable public interest. In this regard, I seek statement from the chairpersons of the Committee on Finance and the Committee on Agriculture to clarify the following. What were the views, memoranda, or feedback from the residents, stakeholders, and other interested parties during the public participation exercise? And how are these incorporated into the final decision? Number 2, plans on revival of the sugar sector, including the nuclear land and ownership of the privatized companies. 3, whether there is any plans for collaboration within the county assembly, of Kisumu for the successful implementation of the new lease arrangements. Number 4, any measures being taken to safeguard the rights, welfare, and economic interests of the workers, including pensions, if any, and local community following the privatization. And lastly, Madam Speaker, history of workforce uptake in the transition period. Honorable Speaker, this matter is of grave importance to the residents of this county, and I humbly request that the chairpersons provide comprehensive response to this House. Thank you.
Honorable members, I'm not able to support Chair Agriculture, and I'm able to support the deputy. Honorable Bill, do you have something to say?
Thank you, Chair. Madam Speaker, I wanted to request for time so that we'll give this House around 3 weeks. Thank you.
Thank you, Honorable Bill. As requested and as the procedure, I'll give them 14 calendar days to investigate and file a report, then bring it back to the Honorable House. Thank you. Honorable Adonija.
Thank you, Madam Speaker. Honorable Speaker, pursuant to provision of orders number 41 2B of the standing orders, I rise to seek a statement from the chairperson of the Committee on Education, Technical Training, Innovation and Social Service regarding the alarming discrepancy and apparent anomalies surrounding the allocation, withdrawal and subsequent requisition of bursary and scholarship funds in the county government of Kisumu for the year 2024-2025. Honorable Speaker, as we can recall, during the budget cycle for the year 2024-2025, this Honorable Assembly approved an allocation of 205 million specifically earmarked for bursary and scholarship to support deserving learners across the county. The bursary program remains one of the most critical interventions in our education sector, directly touching the lives of thousands of needy students and ensuring that no child is denied the right of education due to financial hardship. However, it has come to the attention of this House that 100 million of the allocated fund was withdrawn at some point during the financial year. Alarmingly, records indicate that this substantial amount was not utilized for its intended purpose of paying bursaries and scholarship. Its expenditure remains unclear. This raises serious concerns about the prioritization of education and the proper utilization of public funds. Even more worrying is that the department in charge of bursary has now only made a requisition of only 65 million, leaving a puzzling shortfall of 140 million from the original allocation. At the same time, bursary for the current financial year remain unpaid, leaving many families stranded at the school, demanding fees from students who are depending on this allocation. Honorable Speaker, this situation raises serious questions of accountability, fiscal discipline, and transparency at a time when parents and guardians in Kisumu County are under immense financial strain. Such inconsistencies in the handling of education funds risk eroding public trust and undermining this assembly's oversight role. The lack of clarity over the expenditure of these funds paint a worrying picture of how public resources meant to empower our children are being managed. This House and the people of Kisumu deserve answer. Honorable Speaker, in light of the above, I seek that the chairperson of the Committee on Education, Technical Training, Innovation and Social Service urgently provides a comprehensive report addressing the following issues. Number one, clarification on why 100 million was withdrawn but not used for the bursary and scholarship, and a detailed breakdown of how this amount was ultimately spent. Number two, furnish this House with a complete and audited report on the expenditure of the mentioned 100 million. Number three, an explanation as to why only 65 million has been requisitioned so far for bursary, despite the Assembly approving 200 million Kenya shillings for the same purpose. Number four, a detailed update on the balance of a detailed update on the balance of 140 million from the approved bursary allocation, with a clear indication of where these funds are currently being held or how they have been utilized. Number five, a timeline and concrete plan for disbursement of the pending bursaries to ensure no deserving students is disadvantaged due to delays or mismanagement of funds. I therefore urge the chairperson of the committee to table a substantive response to this statement within the shortest time possible, so that this House may take necessary action to safeguard the integrity of the noble program and restore public confidence. Thank you, Madam Speaker. Madam Speaker. Madam Speaker, I'm kindly requesting if you can give us like 2 minutes so that any honorable member with any additional anything to add on top of this statement. Thank you.
Okay, honorable members, the statement by Honorable Frederick Adonija is a bit contentious, So I'll do as per his request. But remember, as our going by our standing order, stated hour should not go beyond 3 p.m. And we only have 2 minutes. So if you are lucky to get that opportunity, use 30 seconds. It is not a debate, honorable members. It is just a comment or to add something may be have left out. Okay, Honorable Nyauki, I saw you first.
Thank you, Madam Speaker. Madam Speaker, the statement which has just been sought by my good friend, Honorable Odari, is a unifying statement, Madam Speaker. Madam Speaker, if there is one hell of problem that we have in our wards back home, is the issue of bursary. Madam Speaker, several questions or telephone calls that is being made to us to explain why we are unable to disburse these funds is giving us really sleepless nights. And Madam Speaker, they have even started a narration that since we came in, some of us, maybe they think that we have disbanded this issue of bursaries. And you find previously, like the previous members that were here, they are saying, you see, nowadays you are not even getting the bursary. Before, when I was there, I used to get the bursary. Madam Speaker, this is a very serious issue. And the statement which has been sought by Honorable Odari should be answered, because we really need those answers and the way forward to see exactly what are we going to do and what are we going to explain to our constituents. Thank you, Madam Speaker, for that opportunity.
Honorable members, it is already 3. So I'll just advise that any member who has any concern to join the Committee on Education to ensure that his or her concern is captured in the report. So I'll refer this statement to Committee on Education, and I'll give them 14 calendar days to do a report and then bring it back to this Honorable House. Next order.
Commencement of business. Order number 9, motion. Adoption of the report of Joint Committee of Medical Services, Public Health and Sanitation, and Labor and Social Welfare Services on the inquiry into the matter of payment and deductions on stipends of community health promoters.
Honorable Vincent Jagongo.
Thank you, Madam Speaker. Madam Speaker, orders number 41, 2B, the standing orders allows honorable members to seek statements from committee chairpersons of matters of topical concern that fall within their mandate of their respective committees. In line with this provision, and while exercising his oversight role, the honorable member for Kubua Ward, Honorable Bill Odhiambo, during the House sittings Wednesday, 7th May 2025, sought a statement drawing the Assembly attention to allegations of reductions of stipends paid to the community health promoters, that is the CHPs, as seen in the next one. The honorable member requested a formal response to the issue therein from the chairperson of Committee of Labor and Social Welfare Services. However, owing to the cost-cutting nature of the issues, the honorable speaker, in his wisdom and pursuant to orders number 185 of the standing orders, directed that the matter be handled by a joint committee comprising of the Committee of Labor and Social Welfare Services and Medical Services, Public Health and Sanitation. The Speaker, Madam Speaker, the scope of this inquiry is limited to the following issues as were outlined in the statement. One of the issues that was raised was on clarification of the legal policy, whether there was a legal policy, administrative framework governing the payment of stipends to community health promoters in Kisumu County. Number 2, that was also raised was a detailed, the honorable member wanted a detailed breakdown of the monthly stipend amount allocated to CHPs and the agency or the department responsible for this disbursement. The third issue was an explanation of the nature, percentage, and legal basis of all deductions made from the CHP's stipends, including whether such deductions are statutory, policy-driven, or administrative in nature. The fourth issue was information on whether the payment of stipends has been consistent across all the wards and sub-counties, and if not, the reasons for the disparity. The issue number 5 was...
Honorable members, kindly consult in low tones.
Thank you, Madam Speaker, for protecting me from member for Kondele Ward. Issue number 5 was evidence of whether CHPs were adequately informed or consulted before the deductions were affected, and whether consent was obtained where required. Issue number 6 was measures being undertaken to resolve the concerns raised, ensure timely and full payment of stipends, and improve on the transparency, fairness of the payment process. The last issue, that is issue number 7, was on steps taken by the County Department of Health to monitor and audit the payment and deductions to ensure accountability and compliance with public finance laws. Madam Speaker, the committee relied on the information provided by the Department of Medical Services, Public Health and Sanitation to gather information. The following were the methods employed for this case. 1, there was a stakeholder engagement. 2, review of relevant reports and documents, and 3 was on the issue of research. Madam Speaker, the Joint Committee expressed its sincere gratitude to all its members for diligently participating in the proceedings of this inquiry. The dedication and contribution were instrumental in shaping the contents of this report. The committee also acknowledged the valuable report of the officer of the Speaker, the clerk, the Assembly, the Director of Legislative Procedural and Committee Services, and its Secretariat for Logistical and Administrative Facilitation. Special recognition goes to the Honorable Member for Kubua Ward, Honorable Bill Odhiambo, for the attention of the bringing to the attention of the County Assembly this important matter. This proactive approach provided the basis for the inquiry. The report is therefore submitted with the hope that its recommendation will inform a stronger intervention and foster a healthier working environment of the county health workforce. It is now my pleasure, on behalf of the committee, to move that this House adopts the report of the Joint Committee of Labor and Social Welfare and Medical Services, Public Health and Sanitation on the inquiry into the matter of payment and deductions of stipends to community health promoters. Madam Speaker, on our submission, following the establishment of the committee and during its maiden meeting, it resolved to communicate the issues sought by the CEM responsible for medical services, public health and sanitation to the office of the clerk, and via a letter on the reference CAK 3/6/2025, dated 3rd June 2025, as you can see in the annex in page 15. A formal communication was made to the CCM seeking response to the attention to the attendant matters. The committee received a response from the County Executive Committee member of Health and Sanitation through letter dated 11th July 2025 in the Annex 3 in page 16. The first issue, which was on clarification of the legal, if there was a legal policy, administrative framework governing the payment of stipends to community health promoters in Kisumu County, that remuneration of the CHPs is anchored in section 15(6)(a) and B of the Kisumu County Community Health Services Act of 2022, as seen the annexure 4. Community health volunteers shall be paid a facilitation allowance in accordance with the provision of the regulation of this act. The County Executive Committee member responsible for health shall make necessary regulations as to the implementation of this clause A above. That the process of developing this regulation is currently underway and a draft copy has already been completed. Issue number 2, on the detailed breakdown of the monthly stipend amount allocated to CHPs and the agency or department responsible for its disbursement, that the amount set aside for payment of stipends is Kenya shillings 22,305,000 per quarter, amounting to 89,220,000 in a financial year. That the Department of Finance is responsible for disbursement of these funds to the CHPs. That issue on explanation of the nature, percentage, and legal basis of the deduction made from the CHP's stipends, including whether such deductions are statutory policy-driven or administrative in nature. The answer was that evidence by the attached payment vouchers, C Annex 5, no deduction are made from the amount paid to the CHPs. Each CHP is entitled to a stipend of 2,500 per month, which is disbursed on a quarterly basis. That upon receiving complaints regarding deductions, the department conducted investigation and established that some CHPs had taken mobile loans using their phones. As a result, once payments were made, the loan repayment were automatically deducted, leaving them with less than the expected amount. Depending on the bank to which the payment were processed, additional charges such as processing fee and are applicable to the beneficiaries' accounts. This is further cause of the reductions in the net amount received. The fourth issue on the information on whether the payment of stipends have been consistent across all wards and sub-counties. The payment of stipends has been consistent across all wards and sub-counties as shown in the Annex 5. Fifth issue was on evidence of whether CHPs were adequately informed or consulted before deductions were affected and whether consent obtained were required. The answer is that there are no deductions made by the county government on this community health promoters payment, as shown in the attached copies of payment vouchers Annex 5. Issue number 6 was measures being taken to resolve the concern raised to ensure timely and full payment of stipends and improve on the transparency and fairness of the payment process. That the committee finds this concern inapplicable as the stipends are paid in full, as evidenced by the attached payment vouchers. Issue number 7 was on the steps taken by the County Department of Health to monitor and audit the payments and deductions to ensure accountability and compliance with the public finance laws. The answer is that remuneration of the CHPs, just like all the other payments to the county, follows normal financial management procedures. Auditing for these payments is done with the other county payment by both the internal auditors and the Office of the Auditor General Office under the Public Audit Act 2015. Madam Speaker, we came up with the following findings. From this submission in relation to the attendance matters as sought by the Honorable Member for Kobua Ward, the committee found as follows: that payment of CHB stipends is anchored in Section 15(6)(a) of the Kisumu County Community Health Services Act 2022. 2. In response to one above, the committee finds the CCM, responsible for medical services, public health and sanitation, is in contravention of the Section 15(b) of the Kisumu County Community Health Services Act 2022, which obligates him to formulate regulation for its implementation. 3 years down the line, this regulation are yet to be formalized. That's 3, that the amount set aside for payment of stipends, CHPs, is 22,305 per quarter and 89,220 in a financial year. 4, that the Department of Finance is responsible for the disbursement of these funds to the CHPs. 5, the allegation of unlawful deduction from the stipend paid to CHPs are unfounded, and 2, as each CHP is entitled to a stipend of 2,500 per month disbursed on a quarterly basis as evidenced by the payment vouchers externally attached, indicating 7,500 paid in each CHP per quarter. See in the annexes document. That some CHPs had pending mobile loans whose prepayment. 6. That some CHP members had pending mobile loans whose prepayment were automatically deducted from their payments made to them, hence the less receipts and the expected amount. 7. That fees and charges applicable also added to the deductions experience. 8. Like all other counties' payment, the enumeration of the CHPs follows the normal financial management procedures and auditing duly conducted alongside other county payment by both the internal auditors and the Office of the Auditor General, and in accordance with the Public Audit Act 2015. Madam Speaker, we came up with the following recommendation. 1, that the CC member for Medical Services, Public Health and Sanitation should prioritize finalizing the Kisumu County Community Health Services Regulation. This will ensure that renovation process are legally defined, well-grounded and standardized, thereby preventing confusion or misuse and providing a formal framework for addressing any future disputes regarding the nomination of CHPs. This regulation should be submitted to the County Assembly within a period of 1 month, failure to which the Committee of Delegated County Legislation should take up the matter and invoke necessary sanctions. 2, that the Committee of Delegated County Legislation should fast-track the processing of the Kisumu County Community Health Regulation and other that are pending. 3rd, that the Committee of Delegated County Legislation should ensure timelines for formulation of processing of regulations thereto, failure to which the committee alongside the Assembly should invoke appropriate sanctions as provided under the County Government Act and other enabling legislations. 4, that the Department of Medical Services, Public Health and Sanitation, in collaboration with financial institutions, should organize targeted financial literacy workshop for the CHPs, which should cover, among other areas, the risks associated with mobile loans and automatic deductions on their finances, as well as comparison of the banking services and related charges. Such initiative will enable the CHPs to make informed decisions on borrowing and managing their banking services. 5, that the ECM responsible for the finance and ICT should establish clear standard SOPs for the disbursement of stipends with periodic reporting to the County Assembly. This report should detail disbursement timelines, payment status, and reconciliation of funds to foster transparency and legislative oversight. 6, that while the committee found the allegations of unlawful deductions to be untrue, the committee recommends the development of a dedicated publicly accessible payment verification system, which would allow CHPs to verify their payment in real time, strengthening trust between the county government and the community health workforce. Madam Speaker, community health promoters are the first point, in conclusion, Madam Speaker, community health promoters are the first point of contact for households, providing essential health, education, disease prevention, and early intervention services that reduce the burden on higher level health facilities. Prompt and fair remuneration not only motivates and retains this vital workforce, but also demonstrates the county's commitment in valuing their contribution to public health. The committee, together with the departments, are committed to ensuring that timely and adequate payment of stipends community health promoters is prioritized. This is crucial for ensuring that the effective delivery of primary health care services in our community level, and build a resilient health system that aligns with the principles of universal health coverage and devolution. This report is therefore submitted with the hope that this recommendation will inform a stronger intervention and foster a healthier working environment for the county health workforce. It is now my pleasure on behalf of the committee to move that this House adopts the report of the Joint Committee of Labor and Social Welfare and Medical Services, Public Health and Sanitation on the inquiry into the matter of payments and deductions on stipends of community health promoters, CHPs. I call upon the Honorable Millicent Omuya to second the adoption.
Yes, Honorable Millicent Omuya.
Thank you, Madam Speaker. I do second.
Honorable members, now that a motion on adoption of the report of Joint Committee of Medical Services, Public Health and Sanitation on Labor and Social Welfare Services on the inquiry into the matter of payment and deductions of stipends of community health promoters has been presented and seconded, I want to propose a question, and I propose that the motion on adoption of the report is open for debate. Yes, Honorable Nyauke, Central Nyakach. Sorry, South Nyakach.
North Nyakach.
North Nyakach, sorry.
Thank you. Thank you, Madam Speaker. I stand to support the adoption of this report. Madam Speaker, and at the same time, I want to give lots of thanks to Honorable Bill, who raised this matter and requested for answer. Madam Speaker, anxiously, I've also been waiting for this report to see exactly, to be enlightened on the problems that the CHPs are undergoing. Madam Speaker, these are very important persons. From all the wards, I can say categorically that even from all our wards within the county, the CHPs are doing a very fundamental and having a fundamental responsibility back in our communities. Madam Speaker, they have always, in most cases, in several meetings that we have with them, they always raise this question. Number one is about remuneration, which they feel is still below standard. Madam Speaker, and even apart from that, they have been indeed complaining about deductions. I'm learning today from this report that those deductions might not have been true, or the claims might not have been true. And I thank the committee for digging into the whole of this matter. And now we are aware exactly on what is taking place. Madam Speaker, this report, once adopted, it will also help us to sit together with the CHPs that we have in our areas. And sometimes, if they ask such kind of questions, we can see ways and means of letting them know. Otherwise, Madam Speaker, I would also like to impress upon this House that the regulatory frameworks, which is still pending, should be done so that we need to really think on how to remunerate these CHPs in a proper manner. Madam Speaker, it is through that we are going to encourage them and that they are going to work so hard, even more than what they are doing right now. Thank you, Madam Speaker. I beg to support.
Yes, Honorable Were Nyalenda B.
Thank you, Madam Speaker. Madam Speaker, I want to commend the joint committees for a job well done. Madam Speaker, I only picked on one recommendation, which is vital for the committee and for this House. Madam Speaker, if you work on recommendation 1, which is making the regulation that is going to safeguard the interests of the CHPs, I think everything will be cured, Madam Speaker. Let's rush and push the executive so that they ensure that regulation is made. So that can also ensure that this thing is fast-tracked and this thing is enforced so that it can work, so that we have timely payment of the stipend to these other people. Otherwise, Madam Speaker, I beg to support.
Yes, Honorable Bill Oliver Kobura Ward.
Thank you, Madam Speaker. Madam Speaker, I want to thank the Joint Committee for a report well done. At least even the CHPs, when they get this report, I know they'll really appreciate. I want to thank the two committees because there was a lot of concern. Because when we walk in our wards, the CHPs had a lot of complaints about how they are being paid. And some of them were saying that they were not getting enough money. So I want to thank the two committees for giving clarifications so that we all understand as the House of what really is happening, so that whenever we get the complaints, we can explain to them what is happening. Madam Speaker, I also want to support that recommendation of the regulations to be put in place so that this can legally bind the county government to remit the allowances that is given to the CHPs to encourage them to do the work that they're doing. And I also want to support, I see our president really trying to help the CHPs, and I believe in the near future, they'll be getting more compared to what they are really getting, because the impact of what the CHPs are doing on the ground is really something to be admired. They should be even given more training and made to understand their job well, so that we even reduce, because they are the first contact with the people on the ground, and their impact. They can also help to reduce some of these diseases because they are the people who talk to people around. So encouraging them, and I support really what the president is doing, trying to give them more recognition so that if their impact is really felt, I support.
Yes, Honorable Kennedy Uko.
Thank you, Mr. Speaker. Madam Speaker. Madam Speaker, let me thank the member for Kobura Ward for bringing this statement to the House. And let me also thank the committee, the two committees, and the Chair for Health for elaborate and extensive report. This is an eye-opener, Madam Speaker. These are very important people within our communities. These are the people we are relying on, especially on matters of health. They detect fast, they report back. Madam Speaker, these are the people we are even giving the testing kits to help to identify whether malaria is on any person down there. And they are also given some drugs to administer before going to the hospital, Madam Speaker. So this we can't underscore their role. They are very important people within the society. I'm only surprised to find today that nobody has been deducting any money from these people, as has been believed. It is true I've had a direct contact with most of the CSPs, especially within my ward. And this is a complaint which is also coming from some other wards. But on doing a thorough investigation and the report by the oversight committee and relevant committee, Madam Speaker, I may not, I'm tongue-tied in one way, because I've also believed that these people have been deducting a lot of money from them. It's true, whatever we are trying to compensate this community or these people, it is meager. It is so small. I think we should come up with a regulation as recommended. A regulation that will ring-fence the activities of the CHBs, and it will also protect them. And it will also protect the county. Suppose we are taken to court to explain how we are giving the 2,000 and over to the CSBs. Madam Speaker, we might not even win that case because we don't have any regulations and fencing the operations of these very important people within the health sector. So I support the report. It is advisable. We should pick it from there that we have realized there's a gap which can only be filled by the county assembly. I support. Thank you, Madam Speaker.
Yes, Honorable Warindo.
Thank you so much, Madam Speaker. Let me also thank the committee and the author of the statement for bringing this to the House. Mr. Speaker, Madam Speaker, out of the functions that were devolved in Kisumu County, it's the health sector that has been giving Kisumu a good name. And I really want to thank the CHVs. I want to believe they also the CHVs for also contributing to this good reputation of health sector of Kisumu County. And I was also surprised that there are little stipends being deducted, but from the report it's so clear that the money that they're being given has got no deductions, and we are only requesting for the regulations so that their stipends can also be looked into. If these are people who have just volunteered and they are doing it on a daily basis, some of them have taken this as their work, and they really need to be looked into. And Madam Speaker, their number is too huge, and with that they can reach the people on the ground at the lowest, at the easiest time possible. Madam Speaker, if this is going to help us maintain the good reputation of the Kisumu County, let me also be on the answer that I support the report from the Joint Committee. Thank you so much.
Yes, Honorable Alice Wajir.
Thank you, Madam Speaker. I rise to support the report of the Joint Committee. First of all, I want to start by appreciating what the Joint Committee has done. They have really done a very good job by coming out with an elaborate and detailed report on the issue of the community health workers. I also want to applaud our Honorable Billy for coming up with this issue, which is a thorn in the flesh in all the wards in the in our county. As you are aware, Madam Speaker, the community health workers have been doing a very good job in our community. These are the people who our people in the grassroots depend on when it comes to the issues of health. When there's a problem of health issues in our community, the first person which our people look for or depend on is the community health workers. Madam Speaker, these people have volunteered their time. These people are not paid, and they walk throughout the wards in our county doing the commendable job. I want to support that the relevant department should come out with a regulation so to fast track their payment, especially the stipend which they are supposed to be getting. I'm also in agreement that their training should also be enhanced, because if the trainings are enhanced, all our people they are going to reduce the cases of death in our society, because you are aware that most of them treat these diseases like malaria and all those other issues which affect our children in the community. The mortality rate will be low, and it is going to give our hospitals a very easy time. And I want to ask the relevant communities to take this matter seriously so that we can stand with our community health workers. Thank you so much, Madam Speaker.
Yes, Honorable Adonija.
Thank you, Honorable Madam. Judging by the mood of the House, let me call the mover to reply.
Honorable Vincent Jagongo.
Thank you, Madam Speaker. Madam Speaker, I want to take this opportunity to thank all the members who have contributed to this motion. And indeed, I've captured a few issues that they've deliberated during their contribution. Madam Speaker, it's true that the CHPs are doing a good job within our community and they need to be supported fully. Madam Speaker, the issue that has come out clearly, the issue of regulations. Madam Speaker, I want to request that the committee responsible for following up regulations should take the matter and push it so that we can have regulation on the bill that was passed in 2022 on the community health promoters bill. Two, we also want to thank the national government for also picking up on the issue of the CHPs, and we believe they'll continue with supporting them, financial support and any other training that they need to have within their community. Madam Speaker, the stipend that is given to them, that is 2,500, given on a quarterly basis. That is 7,500 per quarter. And I believe this money sometimes is subjected to deductions from the bank. So once banks do their deductions, some of them end up not getting this money in total. So they might think that they were given less money, and yet it is bank charges that has affected their pay. Madam Speaker, I want to urge all the members of this county assembly that let us, all of us, join hands together and we support the community health promoters. We all know that the community health promoters are the level 1 hospital, and they're the first contact within our community as the primary healthcare is concerned. So let us support them. If there's any necessary support that we can give them, the better. Madam Speaker, the 2,500 per month is very little. And I want to urge this assembly that come the next budget, let us consider if we can raise this money even by 500 shillings so that we can push it from 2,500 to 3,000. Initially, we started with 3,000, but it came back to 2,500 during the COVID time. So I believe we can still go back to the 3,000 per month so that we support them and help in the preventive measures that they've always been doing to help us control diseases in our ward levels. Madam Speaker, I reply. Thank you.
Honorable members, now that a motion on adoption of report of Joint Committee of Medical Services, Public Health and Sanitation on Labor and Social Welfare Services on the inquiry into the matter of payment and deductions of stipends of community health promoters has been presented, seconded, and debated. I want to put a question And I put that as many as the opinion that the motion on adoption of the report of Joint Committee of Medical Services, Public Health and Sanitation, and Labor and Social Welfare Services on the inquiry into the matter of payment and deductions on stipends of community health promoters as presented and deliberated upon be adopted, say aye. As many as the contrary opinion say nay. And the ayes have it. And the report and the motion on adoption of the report of Joint Committee of Medical Services as Public Health and Sanitation and Labor and Social Welfare Services on the inquiry into the matter of payment and deductions of stipends of community health promoters has been adopted today, Wednesday, 3rd September 2025 at 15:40 hours. And I want to direct that the recommendations of this report and that of the Hansard be directed to the relevant department and the implementation committee to do a follow-up for the implementation of the same. Next order.
Madam Speaker and honorable members, there is no any other business in the order paper.
Let's be upstanding, honorable members. Honorable members, there is no any other business before this honorable house. Therefore, they stand adjourned till tomorrow, Thursday, 4th September 2025 at 2:30 p.m.